May is Mental Health Awareness Month, and one organization is trying to make it easier for people to get informed.
Yeah, this is some great news. So the National Alliance on Mental Illness, or NAMI, is providing free resources for people. That's the key word here.
That's awesome.
Psychologist Dr. Laura Saunders, who is also the director of Hartford Healthcare's Center for Gender Health, shows us what's out there so that we can all get some free help. Good morning. Happy Thursday. How are you?
I am well. Happy Thursday to all of you. And yes, we are highlighting NAMI. So NAMI is a really, really important national organization, although there's Connecticut chapters as well. And as you said, Caitlin, it stands for the National Alliance on Mental Illness. And NAMI is a tremendous resource, and they have a toolkit that's come out here in the month of May to highlight Mental Health Awareness Month.
How long has NAMI been around, Doc? Has it been around a while, or is this something new? Or?
Yeah, it's been around for a very long time.
Okay.
And there are regional groups in Connecticut, and NAMICT.org is their website. So it's been around for a very long time, and they have a lot of great resources. And what's most important is that a lot of those resources are free.
Yeah, which is great.
Yeah, the free is just outstanding to get people the help that they need. But Dr. Saunders, the NAMI toolkit that's available, what does that include? What can people look for?
So the toolkit has websites, it has social media information, it has local resources. One of the things that NAMI provides is support groups. So for parents or caregivers or siblings of people, individuals struggling with significant mental illness, there's a lot of support groups and resources, because the people that are around the individual with mental illness also struggle and suffer, and they need support also.
Yeah, the statistics, I mean, I'm reading it here. 1 in 5 U.S. adults experience mental illness each year, and only half of them receive treatment. That's not good.
Yeah, and I think that's what's so important, is that it's connecting with resources. One of the things that the toolkit emphasizes, and something we've talked about on this segment, is 988. Remember, 988 is the alternate crisis hotline for individuals struggling with a significant and serious mental health crisis, separate from 911.
Right. Yeah, that's such an important tool that was actually pretty recently available to the entire country here. But we're just looking at some of those statistics. 50% of all lifetime mental illness begins by age 14, and then 75% by age 24. We're not talking about older adults. We're talking about young adults who need access to mental health. And this is so important because May is Mental Health Awareness Month, right, Dr. Saunders?
Yes, and I'm happy that you pointed out that statistic, because that's so important to realize. Is, I'm not saying that some of our elder folks can get depressed or struggle with things at times, but realize that serious and significant mental illness generally emerges in adolescence and young adulthood. And the earlier you get treatment, the better it is, the better the outcomes are. So, and one of those other statistics is like there's 11 years sometimes between when symptoms first emerge and people get treatment. 11 years. That's a tremendously long period of time, and a lot of wasted time where support, treatment, therapy, medication can really thwart the negative effect of symptoms.
This says 122 million people live in mental health professional shortage areas. That's about a third of the nation.
Right. And even if think about this state, right? Think in terms of this state, I always say there's lots of treatment along the interstate corridors, right? 95, 91, and 84. But then when you get to the other pockets of the state, treatment centers and resources become less available. So even if you think within our own state, we're pretty progressive, we're pretty populated, but we have some vacant areas as well where we need more mental health support and treatment. Kind of like the segment on autism down in Old Saybrook.
Right, exactly.
And, that's why it's becoming, I think, Dr. Saunders, more of a conversation within, we were just talking about how this is affecting younger people, a conversation about why mental health resources are needed in schools.
Absolutely. And because oftentimes the problems are identified by school support professionals and teachers. And if you think about teachers have such an incredible, baseline of what is typical and non-typical development. So when they see a child who seems excessively withdrawn and not enjoying activities and not really able to perform in the way that they used to perform, they look like they're becoming very depressed or anxious. That's really important information, and we shouldn't just sort of push that aside and say, oh, it's just because they're young, or it's just because, they don't like math. We really need to address these symptoms and take them seriously.
We have like 20 seconds, Doc. Is it both online and in person, these free resources?
Yes, NAMI has both online and in-person resources, and they're dotted at different points around the state.
Okay, we're going to put the information on our website. Thank you so much for being with us today.
Have a great day.